title of my little talk today is A Great Controversy in Our Mouths. And there's a number of topics that I could discuss, but today I'm going to basically be covering the subject of mercury fillings and why and how that is a controversy in our mouths and its implications for our general health as well.
Will they be able to ask you questions, Dr. Clark, in the end?
At the end?
We don't,
okay.
Yes, with
right.
that of your presentation.
Okay, sure.
Okay, all right, thank you.
One of my favorite verses is in Psalms 103, verse 1 says, "Bless the Lord, O my soul, and all that is within me. Bless his holy name." And then verse 2 to 5 says, "Bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquities, who heals all your diseases, who redeems your life from destruction, who crowns you with loving kindness and tender mercies, who satisfies your mouth with good things so that your youth is renewed like the eagles." I'm sure these are verses that you have referred to many times in your health messages and programs here on Medical Ministry online program. But I would just like to point out that God's ways bring benefits, entirely benefits, not partial benefits. Man's ways brings diseases and problems with our health. And so it's encouraging me to know that God promises to heal all of our diseases, not just some of them. And so many of the diseases caused by mercury are listed as having no known cause and no known cure. So that, of course, is man's assessment of it, whereas God's assessment is that he has a solution. He has an answer for all of the diseases that sin brings with it. Also, it's encouraging to know that he wants to satisfy our mouth with good things. And so I hope by the end of this lecture, you will be determined to make sure your mouth has only good things in it, and that God can renew our health and our youth by taking strong actions to make sure our mouths are full of good things. Well, just a little background of my my history here. I was trained at Loma Linda University a few decades ago and practiced the first 9 years of my dental practice as I was taught, but I was having some real concerns about some of the things I was seeing and wondering about what I was doing that might affect people's health, especially about into the 9th year, I think it was. I had a call from a mother who said her son, who was 21 years old at the time, had a disabling muscle disease that the doctors couldn't identify, but she wondered if it might be related to the mercury fillings that I had placed 2 years before. So initially I kind of bristled and said, no, they're safe. But then I think the Lord must have impressed me to tell her, well, as a professional, I don't feel obligated to change those fillings, but as a Christian, since you've asked, I'll be happy to. So I changed his mercury fillings to white composite fillings. And a few months later, he recovered from his disease, illness, and was able to go back to work. That kind of made me really wonder what was going on. And then about this time, and it's just kind of out of the blue because I didn't know these things, there's two little ladies at Weimar College, this was back in the 80s, sent me a list of Spirit of Prophecy statements that talked about mercury. And let's see, I think I have one of those here. Let me skip down here to slide 8. Yes, this statement from Spiritual Gifts. It says, mercury, calomel, quinine have brought their amount of wretchedness, which the day of God alone will fully reveal. Preparations of mercury and calomel taken into the system ever retain their poisonous strength as long as there is a particle of it left in the system. And it just struck me that this statement and the one I'm going to read following agrees entirely with some of the science and the research that I had been studying. And it's faith building to realize that God has sent us a prophet that tells us so many details of how to live in these final days. So the emphasis here is a particle left in the system. And I'm sure Ellen White did not know that mercury is a gas at body temperature, that it's sublimating or vaporizing 24 hours a day when we have mercury fillings in our teeth. And she had no way of knowing that even if there's just a tiny bit of it left, that mercury is going to continue to vaporize and affect the person's body. We have seen some amazing things with, like this young man I just mentioned, just very, very small fillings. I think he only had 2 BB size fillings, and yet it had a devastating effect on his health. Another statement here, she says, every poisonous preparation in the vegetable and mineral kingdoms taken into the system will leave its wretched influence, affecting the liver and lungs and deranging the system generally. Nor does the evil end here. Diseased, feeble infants are brought into the world to share this misery, transmitted to them from their parents. How would Ellen White know that mercury passes the placental barrier? Research done in Canada 30 years ago showed in sheep that the amount of mercury coming from a pregnant sheep's teeth with mercury fillings in it transmitted that mercury to the fetus at an even greater rate than the mother's body was taking it up. So we also know that mercury passes the brain barrier as well, and that's why it has such effect on our minds as well. Well, because of these and a few other influences that we won't take time to look at, it was in May of 1985 that I declared my practice to be mercury-free and began an exciting learning curve leading to biological dental practice. And you might ask, what is a biological dentist? We're all dentists deal with biological organisms. That's what the body is. But let's see if I can find that definition. Yes, a biological dentist is a dentist concerned with the health and integrity of the oral cavity and its surrounding structures. This includes the use of materials and procedures that are systemically compatible. So we want to make sure that whatever we're placing in the body, even if it's in the teeth, which we sometimes think of as solid objects, but they're not, it can still have a powerful effect upon the body. One of the principles that I have found true in science and health and many other areas is described in Proverbs 26:2, like a flitting sparrow, like a flying swallow, so a curse without cause shall not alight. Curse without a cause. That means a disease without a cause. Disease could be a curse. So I believe that every disease has a cause. We may not always know what the cause is, but of the 100 plus diseases and syndromes that have been scientifically linked with mercury fillings, Many of them are listed as having no known cause and no known cure as well. But amazingly, by removing the mercury fillings properly and safely, we find most, if not all of those diseases are improved or cured. Let's see the next. Let me skip down here a couple of slides. Oh, yes, one of the things that I learned early on was the fact that these mercury fillings are very similar to batteries. And I have had a few patients with muscle twitching in their face that was eliminated when we took out their mercury fillings. Well, what is the relationship there? Well, it's actually the fact that these fillings are small batteries that are creating electricity that interfere with the electrical system of the body. And so we have patients that, besides the muscle twitching and the facial muscles, we've had cases with hearing loss and tinnitus that was eliminated or much improved with removing the mercury. And we had a case like Pastor Ben. He was a fairly young pastor. I think he was in his maybe late 50s, but he'd had to retire because of some of his health issues from pastoring in New York City. And he moved to the country way out in the middle of the sticks, not far from where I practice in Amity, Arkansas, bought some land, built a little house, and he and his wife were preparing to retire. And he came to me as a patient, and he happened to mention, well, he was concerned, he wanted his mercury fillings replaced. So we took them out and replaced them. And a few months later, his wife told me that his heart pain, angina type pains he had had for 22 years had been completely eliminated after we took his mercury fillings out. And here again, this is a matter of electricity interfering with the vagus nerve, which is very in close proximity to the teeth. So a typical battery is made up of 3 elements: basic metal, lead, a precious metal, silver, and an electrolyte, which in the case of most batteries is sulfuric acid. In the mouth, we see the same thing, though. A base metal of mercury, precious metal of silver, and saliva functions well as an electrolyte. So you can see the direct correlation between a battery and these metal fillings in our mouths. Now, don't try to start your car, though, with it if your battery's dead. It is enough to interfere with the body because the electrical system of the body is functioning on about on nanogram level. And these fillings can produce enough electricity to be not nanogram, nanoamp. And the fillings produce a microamp, which is actually 1,000 times greater electricity than the body's electrical system. So another verse that applies here is Romans 13:11-13, and that knowing the time, that now it is high time to awake out of sleep, for now is our salvation nearer than when we believed. The night is far spent, the day is at hand. Let us therefore cast off the works of darkness and let us put on the armor of light. Let us walk honestly. So if you are needing any fillings, make sure you tell your dentist you do not want metal fillings. You want only white tooth-colored fillings. And by so doing, you can, at least in small part, cast off the works of darkness, because I believe that these mercury releasing fillings are a tool and an invention of the devil because of the implications it has in our spiritual walk, our spiritual warfare. So I believe amalgam fillings, mercury fillings, whatever you want to call them, are definitely works of darkness and need to be avoided. Let's see from here. Yes, another verse is, "For I will contend with him that contendeth with thee, and I will save thy children." We've had some children who had Crohn's disease, which is a painful disease causing digestive problems, that was reversed by taking out their mercury fillings. And God wants to not only save us, he wants to save our children as well. And we want to save our children from many of the diseases that can be experienced by through mercury fillings. And there's a video here, but we won't take time to watch that. Just skip down here a little bit to just a brief look at fundamentals of mercury. If some of you would like to take a photograph of this slide for later study and evaluation, it just gives some of the chemistry and physics of mercury, which at room temperature is a liquid, but it vaporizes actually at body temperature. So 24 hours a day, if you have mercury fillings in your teeth, you will be getting a dose of mercury vaporizing from these fillings. And some people think, well, you know, they've been there 30, 40, 50 years. I should have outlived it by now. But it's estimated that it loses the mercury content by only 10% every 10 years. So please don't try to outlive the mercury vapor coming from your fillings, because you likely will not. It is a colorless, odorless, tasteless gas. I was just thinking earlier that it would have been so much better if that gas had a flavor to it, like sulfur or something that would be unpleasant, and then maybe the fillings would never have been placed to begin with. All right. One other thing we'll look at briefly is the fact that mercury is the most toxic non-radioactive element on the planet. Just by comparison, mercury is more toxic than cadmium, arsenic, thallium, another form of arsenic, and lead as well. So only radioactive elements are more toxic than mercury. So if you can figure out why mercury is safe in your mouth according to many professional agencies, but toxic in the sewer system, that is a mystery I still would like to understand, but I think I know it pretty well. All right, going down just a couple more slides here. Revelation 12:7, "And there was war in heaven. Michael and his angels fought against the dragon, and the dragon fought and his angels." Well, I think that the devil has endeavored to carry that war into every domain that he can think of. And we know that there are so many things when we consider our health that the devil has deranged and disfigured and changed, that we can understand more clearly how that war is going on in our mouths. I was really interested in this final slide here. This was not a Christian author that I know of. He may have been, but I couldn't tell it from the book he wrote entitled A Mouthful of Poison. Dr. Myron Wins summarized some of the effects of mercury, the spiritual implications of mercury. And he said it impairs our ability to make trivial decisions, little, maybe insignificant decisions, but we have more difficulty making those decisions. Number two is it makes it more difficult to resolve doubts, which probably makes our attitudes toward negativity stronger. So, and then the third one was to resist temptations. That's one we as Christians need to be concerned about, isn't it? I remember a patient that I took a couple of his mercury fillings out, and he was a truck driver, and I didn't see him again for 2 years. He came back to have a, I can't remember whether it was a tooth pulled or some more fillings taken out, but he said, "Doc, I don't know what you did to me last time, but since you took those 2 fillings out," he started to say, "I haven't drank at all," but he changed his mind. He says, "I haven't had the tendency to drink alcohol like I did before, and I haven't had as much anger as I did before." And that, to me, is the effect of mercury on our ability to resist temptations and our emotional health. And then the fourth thing he mentions is perform intellectual tasks. We know that the effects of mercury impairs all tissues and organs of the body, but it has a greater effect, a greater affinity to nerve tissue and brain tissue. And we know that it goes rapidly through the nasal passages into brain tissue and can affect our way of our spiritual walk with the Lord. And so as a means of staying healthy, and being more responsible in our walk with our wonderful Creator who can take away all of our diseases, let's determine to make sure that we are not adding to our problems, but detracting from them and making our lives healthier by eliminating something as toxic as mercury. That is all I have right now. If there's some questions, I'll be glad to answer them.
Okay, thank you so much, Dr. Clark. I'm ready to cry, Dr. Clark.
Yes.
Well,
let me see one more.
You know, with all the mercury that I have right now, I don't even know, but mine, it was done at an institution where, you know, they put it in as preventive when I was a child.
Yes, sadly.
But now that you're saying even Crohn's disease is something that's caused by you having mercury fillings in?
In part, at least. I wouldn't say it's the only cause for it, but we have seen some cases of Crohn's disease reversed with by removing mercury exposure. Mm-hmm.
Okay. All right. So we're going to allow everyone to actually ask questions by raising their hands. And if you raise your hands, I'll be able to acknowledge them. Okay. Hold on one second. All right. Go ahead, Taisha, and unmute.
Hi, yes. Thank you, Dr. Clark.
Sure.
I wanted to ask about a root canal. Do you recommend, is there any type of natural holistic resolve for root canals?
Well, that's a very good question. And it's actually another lecture that we won't take time to do today. But I do not recommend root canals. For about 10 years, I thought I was using a better sealer for root canals that was healthier than what is typically used. But that's not the major problem with root canals. But no, there is not a safe root canal of any kind. And another lecture, we can go through the details of why that is.
So do you recommend a resolve to it? I mean, I understand the next lecture, but what is your resolve?
Well, the solution is to, if a tooth needs a root canal, it should be removed before it has a root canal, because a root canal will create 3 miles of microscopic tubules that harbor pathogens, bacteria, virus, fungi, all kinds of ugly things that body has no defense for. So it's related to a number of different types of cancers and chronic fatigue syndromes and other, just a lot of things. And there's so much on the web now that you can learn about the hazards of root canals.
Okay. Thank you. All right. So can you tell us, are there any dangers? Because I noticed you mentioned different metals. So if someone likes to have that style of gold tooth in their mouths, would that be something that is actually dangerous, or how is that?
Well, if you had a lot of gold crowns, for instance, that would be dangerous, not in the same way that mercury is, because it doesn't have anything vaporizing from it. It's a very strong and stable thing, but there is strong evidence that the metals act as like a circuit breaker in the body's electrical systems, blocks the flow of electricity through the teeth to different organs of the body. Okay. So, you know, a small decorative, you know, what they're putting on front teeth sometimes, that probably would have negligible effect on the electrical fields. But a large metal crown, especially a non-precious crown, there are some metals that are used in crowns that have beryllium in it, which is a known carcinogen.
Okay, and what about braces? Because that also has a metal.
Yes, again, it's a smaller quantity. I haven't seen any studies that show that it is a serious impairment of the electrical system.
Okay, all right, go ahead, Ms. Zerline, and unmute for us so you can ask your question.
Good evening, Dr. Clark. Thank you for sharing. My dentist wanted me to get like antibiotic put in my gum because I had a gum infection, and I declined it because I wasn't sure, you know, if I wanted to do this. What do you think about, you know, having them put antibiotic in your gum for a gum infection?
Yes, I used that product for a short time and it has some benefit, but it's very short term. You know, you can't go in and have the dentist put that in your gums every month or so. And the gum disease is actually a bacterial disease, and you need to find a way to eliminate or reduce the quantity of bacteria that are in the gum crevice. Seeing the last 4 or 5, it's become common, is ozone. Ozone destroys the organisms, every type of pathogen, and we just put it in a syringe with a blunt tip and just perfuse it down into the gum crevice. And I think that is much healthier than an antibiotic. We know that antibiotics tend to create some resistant organisms, and ozone will not have that effect at all.
So where would I be able to purchase the ozone?
Well, you can't actually purchase it. You need to find a biological dentist that uses it in their practice. And if you like, I can give you some sources to locate biological dentists. In fact, I think I have a slide. Let me see if I can find it. That I may have to just,
Maybe that's something we can probably.
yeah, we can find and to them. There's two in the Academy of Oral Medicine and Toxicology, the largest group of biological and holistic dentists. And then the other is the International Academy of Biological Dentists and Dentistry and Medicine. And both of those have directory sites on their websites, directories on their websites that help you locate a dentist close to you.
Okay.
Okay, thank you.
Sure.
Okay, go ahead, BJ Brown.
Good evening, and thank you, Dr. Clark, for your information. Since you talked about not having root canals, and you mentioned taking the tooth out, I guess my next thought would be, what are your thoughts on implants?
Well, implants are an excellent way of replacing a tooth, a missing tooth. They do not decay, they do not get gum disease, they do get some peri-implantitis, a little inflammation around it to a small degree. But that is one of the solutions probably, and we place some implants in my practice, but more likely we are replacing teeth with flexible partial dentures that are very aesthetic and have no metal in them. There is a controversy right now in dentistry about the metal in implants. The typical implants are quite large structures. There's another type that's newer, zirconia implants, that is, some people say, does not function like a metal and blocks the electrical pathways, and other research that I talked to and just recently said, yes, they do. So I guess the solution I have found is that I use a small implant called a Bicon implant, which is about 1/3 to 1/5 the size of the typical implants. And if it does block electrical pathways, it'll be much less so than the typical implants. But that is definitely an option, but it's a very expensive option.
Thank you so much. Implants themselves are very expensive.
Yes.
Okay, go ahead, JF, please. Unmute.
Thank you very much. Dr. Clark, I was wondering if you have mercury fillings and you're told that the amalgam fillings will last only a short period of time, or the cavity is too large to have an amalgam filling. What would you say?
And is the dentist arguing that you should have a root canal instead, or if it's...
No, the suggestion was because the cavity was too large, that the amalgam would have to be replaced often and probably wouldn't be adequate.
Well, it's true that amalgams, the mercury fillings, the stated lifetime is about 8 to 10 years, and they do need to be replaced because metal expands and contracts at much greater rate than tooth structure. And so they develop gaps around them. I don't know if you noticed in the picture of the fillings next to the battery, there was some black gaps around the edge of the mercury fillings, which is quite typical. If you can see a gap there, there's room for millions of bacteria to get around there and start decay underneath. The probably alternative to a large filling would be a crown, and but there's never an indication for mercury over composite fillings. The composite fillings have a very similar coefficient of thermal expansion. So when you eat hot and cold foods, they're not going to change shape like the metal fillings do. And they will last much better and actually bond to the tooth structure and increase its strength rather than diminishing the strength of the tooth.
Thank you very much.
Okay, let's go ahead. Ariel, unmute, please.
My question was a little similar to the last one about cavity fillings and what you would suggest other than the amalgam filling.
So, most dentists today are not placing mercury fillings anymore. Most of them are using white or composite fillings, they're called. And that's the best alternative. Don't know what the current statistics are, but I think it's like 30 or 40% of dentists are still placing mercury fillings. Many of the dentists will give you an option of the metal fillings or a white filling. And I would encourage you to always take the white options and tell them you never want a mercury filling. And if they will not give you a choice, then you need to, go somewhere else, because at all costs, you should not let anyone put a mercury filling in your teeth with everything that we know about the health effects.
Thank you so much.
Sure.
Okay, Nika, if you can go ahead and unmute.
Hi, does the mercury causes you to have cavitation or like the flap gums?
Cavitations are caused usually by extractions. There are areas in the jawbone that do not heal after a tooth is pulled. And there's a number of factors for that. But as far as I know, there's no correlation between mercury fillings and cavitations. And I'm not sure what you mean by flat gums, but maybe where teeth have been pulled and the bone resorbs away?
No, like, I mean like where there's, where you have like your teeth, and instead of your gum, it grows so much, it almost covers the tooth or the teeth. So whereby you only see the surface of the teeth.
Oh, I see. Yeah, there are some conditions, disease conditions that can cause the gums to grow like that, sometimes result of medications. But yeah, and occasionally I guess you could have some irritation or inflammation from the mercury fillings, especially if it's not a smooth margin at the gum line that can cause some irritation and growth of that gum tissue.
Okay, thank you. Kim, can you unmute your phone and ask your question, please? Kim, are you able to? Yeah, I'm not sure why, but I got a message that had a question. Okay, so
okay.
What? Hello. Hello.
Yes. Hi,
Okay.
Dr. Clark.
Hi.
Hi, Dr. Clark. How are you? Thank you for being with us today. My question is, what would you suggest for placement of, what would you suggest if you have a cavity? What would you fill the cavity with instead of the mercury? Also, just wanted to share my experience just briefly. I had a cavity filled, and it was very torturesome for me. They did numb the local area, and they used, the normal needle injection as well as the swab. And it became a very negative experience for me. And I have one more cavity that needs to be filled. And I've been looking on YouTube, and I've been seeing a lot of people sharing how the teeth can be healed without filling the cavity. And I would like to know, what is your
We have a, hold on, Kim. We have a lot of background noise. I'm not sure what's happening, but.
Okay, she can mute her phone now. I think I can answer the question. Yeah, there is books that have been written actually about healing decay nutritionally that seldom can happen if the decay is in the chewing surfaces of the teeth, because that's an area where you can't really get to it, and circulation in the tooth is a little different there. The decay that begins in between the teeth and the contact points, I believe that a wholesome diet can reverse beginning decay like that, especially if it has not gotten into the dentin, the layer beneath the enamel. But it takes some adequate minerals and probably a very wholesome vegetarian and maybe a vegan diet to see that happen. But if there are any symptoms of discomfort or sensitivity or hot or cold sensitivity, then I would not risk waiting and trying to see if nutrition would solve it, because likely it won't. The decay would get into the nerve, and then you have no choice but to remove the tooth or do a root canal, which is not a good thing. Does that answer your question?
Thank you.
Okay.
No, he said it's not good.
Okay, can I ask you about the dangers of fluoride?
Well, again, that's another lecture that, you know, my office initially became mercury free, and then a few years later, I read a book about fluoride and my eyes were opened, even though I had been a fluoride evangelist before that. But yeah, fluoride is best to avoid at all costs as well.
Okay, and what about vitamin D? Can that rebuild enamel?
I don't recall reading anything about vitamin D. Of course, it's a very important vitamin, and in this era of COVID, we should all be taking a little vitamin D and K3 to help our immune system. But if there's any connection with rebuilding enamel, I'm not sure. I haven't read about it.
Okay, that's an honest answer. Okay, go ahead, JF, please. Unmute your phone.
Dr. Clark, what would you suggest for periodontal disease where you're being told you'll basically need to remove all your teeth? Is there something that can be, that you can do daily to assist that?
Well, again, that disease is a bacterial disease, and it's not a lack of brushing or flossing. And even though brushing and flossing are very important, but once the pockets around the teeth have gotten beyond 4 millimeters, then your brush and your floss will not disturb those bacterial growths there, and you'll need something else. Sometimes the hard accretions of calculus around the teeth are a big factor in trapping that bacteria and making it more difficult to get it clean. So you will need a hygienist to remove all of that. And then there are some really dramatic revisions of periodontal disease through both laser treatments and ozone. And we've seen some 9 millimeter pockets heal to normal 2 and 3 millimeter pockets through the use of a soft tissue laser. And a number of dentists have told me that they have seen the same effects by using ozone, which is just another tool to destroy the bacteria accumulations in the depths of the sulcus, or the pockets around the teeth.
Thank you.
Mm-hmm. So look for a dentist that maybe has is has a track record of treating periodontal disease with lasers.
Okay, go ahead, Louis, and unmute, please.
Hi. Are you getting an echo or can you hear me okay?
I hear you fine.
Okay, we wanted to know, are there harmful chemicals in the material that they use to bond teeth? And if so, what is the alternative?
In the bonding agents for fillings?
You know how they bond in between the teeth to, you know, to hold the teeth from together or, you know, from falling out?
Oh, when they splint the teeth together with a bonding agent?
Yeah.
I don't know of anything that's harmful in that. It's similar to what is used in fillings. And of course, anything man-made is not going to be as good as what the structures God made for us. But yeah, I wouldn't worry about what is used for bonding and splinting and things like that. It's probably more significant to worry about the gum disease that's causing the need for it. But
I see Nikia or Nika H. You can go ahead and ask your question.
Yes, doctor, how safe are dental implants in terms of the metal that is used to, you know, that they put inside of your gum? Like, are they safe to use?
Mm-hmm. Well, the implant, the standard type of implants is a pretty significant chunk of metal embedded in the bone. It's a wonderful thing for replacing maybe one tooth. If you get more than that, I think it can be harmful. There are some newer kinds of, or different kinds of implants that have much less metal in them, but there's, you know, it's kind of a controversial field in dentistry right now. Many dentists, especially those that are placing a lot of implants, say that it does not interfere with the electrical fields of the body. And there are others who are arguing and showing quite a bit of evidence that there can be problems with implants. So.
Thank you.
Sure. Just as a point of reference, I recently had 3 implants placed in my teeth, but they were really small ones. So hopefully they will not shorten my life.
My second question, do you know of any holistic doctors here in New York?
I don't know of anyone up there, but again, Rowena is going to send out these 2 organizations that have directories on their websites, and you will be able to find someone. I know there are quite a few biological dentists in New York, so you should be able to find someone close.
Thank you very much.
Sure.
Okay, BJ Brown.
Thank you once again. So, Dr. Clark, other than brushing and flossing, what would you say are your 3 top tips for oral health prevention?
I would say drink a lot of water, pure water, spring water if your water is fluoridated, or city water that has a lot of aluminum in it as well. A healthy diet is one of the best things you can do, and getting adequate oxygen would be a third thing. And we're coming to realize that the mouth is a big problem with, because the oral structures are a problem in about 85% of the population in limiting the amount of oxygen that we get. The nose is made for breathing and the mouth is made for eating. And so often because of insufficient growth of the upper jaw, we're not able to breathe as well as we should through our nose. And so, that would be a third thing. And there's a lot of implications in our health if we're not getting adequate oxygen.
Thank you so much.
Sure. Raina, if I stop the screen share, let's see what that does.
Yes, we can see you clearly now.
Okay.
Yes. Are you okay?
Yes.
You wanted to find another document or something to share, or what is that?
Oh, no.
Okay.
No, I was just thinking that maybe I could see the participants a little better.
Okay. Yes, you can. Definitely so. All righty. So the next person to unmute would be the Rodneys.
Yes. So good evening, everyone. I have all my upper teeth pulled out because of periodontal disease. I'm currently using denture, but with the intention to put implants on the upper level. My question is, should I stick with the denture or should I do the implants?
Well, just knowing what the cost of the denture supported or implant supported denture is, if you had an extra $20,000, that would be the best choice. But it's very expensive to have implants placed to support a denture. I've heard quotations from $20,000 to $40,000 or $50,000, but upper dentures work so much better than lower dentures. If implant supported lower denture would be much better because the implants will help to preserve the bone and keep it from resorbing away as fast. Upper denture, you have more surface area, you can develop a better suction, and they work much better than the lower denture where the bone disappears quicker. So I would recommend an implant supported lower denture for sure, if you can afford that, but the upper denture should work well without it.
So my follow-up question then is, I'm really trying my best to keep my lower teeth, even though there are issues there too. I just joined your program, so is there any way that can help minimize, because I have also deep pockets, so somewhat regrow the gums at the bottom so that I don't lose the bottom teeth?
Yes, as I mentioned earlier, find a dentist who is treating gum disease with lasers or ozone. And those have been shown when properly used to restore the attachment and sometimes even the bone around the teeth.
So would that be a once-a-year treatment, a twice-a-year treatment? What would be the recommendation?
Well, the treatment that we've done with the soft tissue laser is usually we see the patient about every 2 weeks, and over a period of maybe 2 or 3 months, depending on how deep the pockets are. And then they can go to probably a 6-month check. And if the disease can be restored or the attachments can be restored, then regular cleaning at every 6 months is adequate.
Okay, we'll go ahead to Sandra Zeck now.
Thank you so much. I have 3 questions, please. What do you think about porcelain veneers? What do you think about activated charcoal rinse? And what do you think about water pick flossers?
Porcelain veneers are excellent. If you have aesthetic problems, I'm kind of jealous of the enamel that God made for us. If those your front teeth have had some, a lot of fillings where there's already damage to the enamel, then porcelain veneer can help save the tooth, and it's less invasive than a full coverage crown. But there has to be a pretty strong reason for me to grind away all the enamel off the teeth, front of the teeth, for a veneer.
Don't they have porcelain crowns now?
Oh yes, yeah, and porcelain crowns is the standard. Yeah, I wouldn't consider a porcelain bonded to metal crown anymore. That's old technology. But again, that enamel is pretty precious stuff, and it's actually part of the circulation of the tooth. Most people don't realize that the tooth has a circulation that starts with the blood vessels on the inside and the nerve, and there's a fluid that actually flows through the dentin and through the enamel to the surface. And so when you grind that away for either a crown or a veneer, then you're limiting some of the circulation of that tooth, which is going to impair its health in the long run.
Mm-hmm. Activated charcoal rinse?
Activated charcoal rinse is good, yes. We give charcoal to every patient that we take mercury fillings out of and have them swish and swallow it. It's good at binding toxins and can also keep your teeth white, believe it or not.
Mm-hmm. And what about Waterpik flossers?
Waterpik flossers are good, but they're not really a replacement for floss. They are good for rinsing after you've brushed properly and flossed, but to be able to disturb the sticky plaque on the teeth, you have to turn it up pretty high setting, and that can push the bacteria down into the gum crevice and create some periodontal issues there.
Even if you put a little, maybe a little clove oil in it and kind of rinse with it.
Tea tree oil, yeah, there's a number of different things you can use that will help to eliminate the bacteria.
Okay, go ahead, JF, and unmute, please.
Yes, Dr. Clark. I was wondering if you could describe how mercury fillings could be removed safely.
Well, there are protocols that have been set up by the International Academy of Oral Medicine and Toxicology over the last 20 years that are all scientifically based. Some of the things that we use and all biological dentists use is a cleanup device, a little plastic device that fits over the tooth and you remove the filling. It's connected to the high-speed vacuum. If people are really sick, we will use a rubber dam. In fact, very often we use rubber dam for everyone unless they have panic attacks or have difficulty. So a rubber dam isolates the tooth even more. We also have a large vacuum that we put right under the chin that pulls the mercury vapor away from not only the patient, but us as well. So we all have less mercury to breathe, and it scrubs that air through a big charcoal filter. We like to have patients rinse their mouth sometimes with ozone water before we begin. We supplement afterwards with activated charcoal and lipospheric vitamin C that is a good chelating agent as well. So quite a few different steps, and some dentists go even further extremes, and the doctor and the assistant are in hazmat suits and totally covered. Also, we have a body shield that we cover the body with to keep mercury from getting on their clothes, and we put a wet towel over their face. Sometimes we'll give oxygen while we're working. So there's a lot of different steps in removing the mercury safely.
Thank you. I didn't realize it was so involved. Maybe that's why sometimes there's hesitancy to remove them.
Well, yes, and many dentists, unless are members of these organizations, have not had the training and do not have the equipment in their office to do that. So that's why it's important not to have mercury fillings replaced by anyone, because the way we were taught to replace them creates a cloud of mercury vapor that you can't see it, but it's there and can affect both the patient and the dentist.
Thank you so much.
You're welcome.
Lamont Wilson. You can go ahead and unmute.
Appreciate the program. Every time I brush my teeth, especially when I floss, my mouth bleeds real bad. And I was getting some work done on my teeth, and the dental assistant, my mouth was bleeding so bad while they were working on me, she got kind of scared. What can I do for the constant bleeding of my gums? See, I had bad gums, but what could I do to reduce the blood every time I brush my teeth and floss?
Yeah, are you flossing every day?
I try not to because it's like a lot of blood when I floss.
Uh-huh. Are you taking any medications that are causing your gums to swell?
No, I take herbs. I don't know if that.
Yeah, I don't know of any herbs that would cause that. When your gums are bleeding, that tells me that you have only maybe 1 or 2 layers of cells on the surface of that skin. And that is because there's irritation in the gum crevice from the bacteria there. And if you were to floss maybe twice a day for a week or 2 weeks, that would eliminate that irritation, and that skin would develop 4 or 5 layers of cells and would be tougher and would not bleed as much.
Okay. Is it a certain type of floss? Like different ones that I try to use for the floss, it like really gets in my teeth and it's like really makes it bleed a lot. Any certain particular one or anything like that?
Well, in your case, one of the best ones would be one that's called Dr. Tung's, T-U-N-G, I think it is. And you can get that online, or I don't know if Walmart was selling it online, but it was really expensive, so just look around. But that is kind of a thicker floss, and it's much softer, and it cleans very efficiently.
Would the charcoal help if I use charcoal more?
Well, it could. It just depends on how you're brushing. There's a technique for brushing called Bass technique, where you place the bristles at a 45-degree angle to the tooth and gum crevice and just jiggle back and forth, disturb those bacterial colonies without traumatizing the gum tissue. So you might work on that a little bit and do that at least for 10 or 15 minutes before you go to sleep at night, and that will eliminate a lot of that bacteria, and then rinse your mouth out thoroughly afterwards. But it takes a little more time with the Bass technique, but it will help your gums get healthier. Also, in your case, you might try some baking soda toothpaste. There's some of that on the market, or you can just make your own, mix some baking soda with salt, and that helps to shrink the swollen gums and eliminate some of that bacteria.
Okay, so thank you so much. We're gonna go ahead and just allow 1 question per person. We are coming to the close. We have Genevieve, Jan, and then Brenda.
My question was, I have a tooth abscess and went to the dentist, and they want to do an oral surgery where they will go, I guess, into the gum to remove the abscess, but then the complication is that I could have nerve damage. Is with the biodentistry, could I do the laser or ozone as an alternative, or are there any alternatives?
It would depend on what was causing the abscess. If there was a decay in the tooth that's gotten into the nerve, then you know, there's probably no recourse. If it was just a gum infection that destroyed the bone around the roots, then it's possible that a laser could treat that successfully.
Yeah, it was I had a crown and the crown was leaking, and that's what they said caused.
Oh,
yeah.
okay. Yeah. Yeah. Probably that tooth needs to come out. Sounds to me like.
Thank you.
Sure.
Program, I really appreciate it. I was wondering if you could share your thoughts on the coconut oil pulling. Is it beneficial?
I haven't seen any science behind it. I have quite a few patients that tell me that they find it very effective and helpful. So I know it can't cause any harm, but I think it's a health enhancing procedure.
Thank you.
That was going to be my question as well. Thank you, doctor.
Okay, very good.
Okay, and so Dale, you asked if you can unmute. Go ahead and ask your question, please. Okay, I'm not sure what's happening.
So I just have a quick question here in regards to root canal. So a procedure was done where they removed the root canal, and there was, even after months, there was still like some abscess thing going on, because that was the reason the root canal was removed, because the bacterial overgrowth there was causing a bit of abscess there. But even after a few months, there's still some issues there. Any recommendations on that? And would you have recommended at the time of treatment, like an antibiotic or anything like that?
We occasionally do use antibiotics. Let me ask you, is the trend, what is the trend? Is it pretty much the same symptoms, or does it seem to be getting better gradually?
Better gradually.
Sometimes a large abscess can take months and months to heal. So I would, you know, if it's improving, then I wouldn't be too concerned about it. And maybe within 6 months or a year, go back and have them take an x-ray to confirm that bone is growing back into that abscessed area. Sometimes there's granulation tissue starts forming where an abscess was, and it doesn't heal properly, but usually it gets worse and worse instead of better and better. So hopefully you won't have to go back and have another surgical procedure done.
All right, thank you so much.
Sure.
Okay, Antoinette, you are the last person. Go right ahead.
Hi, thank you, Dr. Clark, for your information. I had a root canal done about 40 years ago, and I was wondering if it makes sense to even try to have it removed.
Yes, I assume you're probably over 50 years old.
I am. I'll tell the world my age, yes.
Okay, if it was done 40 years ago, I'm sure. But yes, it's been shown that one root canal can impair or knock out 60% of your immune system. The unfortunate thing is the longer a tooth has been functioning with a root canal, the more difficult it is to remove. So, you know, because the tooth becomes more brittle and often has to be surgically removed depending on the strength of your bone around it. But I would encourage you to have it removed if you want to maintain excellent health and avoid many of the diseases that we see associated with root canals.
Thank you very much.
You're welcome.
Dr. Clark, thank you so much for being with us today. I mean, did you say 40 or 60% of your immune system is affected by the root canals?
60%.
Wow, that's huge.
What I heard in a lecture many years ago. And I know of 3 physicians who have told me that 96% or 97% of the patients that they see with cancer also have root canals.
Wow.
Now, that's not a scientific study to say that in every case, you know, the root canal has caused the cancer, but there's a strong association, and there are some specific types of cancer that have been known to be caused by root canals. So it's just not healthy to have a dead structure attached to the body without blood supply that can eliminate the pathogens there.
Okay. And can you tell them, can we share your office information if they wanted to come and make an appointment with you? I mean, again, he's in Arkansas, but
certainly.
Can we do?
Certainly. Yeah.
All right.
We, like many biological dentists, I'm one of the few in the state here, so people travel long distances to see me. But yeah, we'd be glad to.
Well, we certainly appreciate you, and we thank you for your time. We know that, you know, our Sabbaths are precious times and precious moments, but we are appreciative of you giving us all this invaluable information today.
Very
so
good.
Thank you.
My pleasure. And God bless each of you.
God bless you. Everyone saying thank you. Can you see that?
Thank you very much.
Thank you.
Thank you.
Thank you very much. Well appreciated.
Thank you.
Thank you.
Thank you so much.
Happy week.
Happy
Same to
week.
you. God bless.
So we're going to have a quick talk right now. We had on someone that, hold on one second. I'm going to stop this. And so we have, Charmin, are you there?